Scanning the room.
Come in.
Closing the door for privacy. Hi, Ms. Santi. My name is Ismail. I'm a student at the University of Detroit Mercy. I'll be doing a head-to-toe assessment on you today. Can you please state your name and date of birth?
Sabrina Anthony, July 11th, 1995.
Do you know where you are?
The hospital.
Do you know what year it is?
2015.
Do you know who's the president?
Barack Obama.
Are you having any pain?
No.
Are you having any allergies?
No.
Patient's alert oriented times 3. Patient's able to answer a complex question. The mood is content. There's no foul odor. She is groomed. There's no signs of illness. Patient says that there's no pain, no allergies. And she is ready to take the head-to-toe assessment. So first I'm going to check the skin. So I'm going to go from the head to the toes. So the skin is warm and dry and according for ethnicity. She is also, like she stated, she is 19 years old, so she's appropriate for her age. She looks appropriate for her age. There are no lesions, which they're not. There's no asymmetrical. There's no irregular borders. There's no weird colors of some sort, and then there's no regular diameters or some elevations of the lesions present. So now what I'm going to do is I'm going to check her eyes for purple. So I'm going to have you look at my nose, please. Thank you. So the eyes are purple, which are pupils equal reactive to light. Pupils equal reactive, round reactive to light and accommodation. I'm going to check her conjunctiva, and conjunctiva is a little bit white. I don't know why. So it should be pink, but it's a little bit white. Now that's okay. So now I'm going to look at your face. The face is symmetrical. Can you please frown, puff your cheeks, smile? So this shows me that, thank you. So this patient shows me that her cranial nerves of 5 and 7 are present. So can you please open your mouth for me? So now I'm going to check her mouth. She has oral mucosa is pink. She has little cavities in there in the back. Can you say ah for me? Uval is reactive when she says ah. The tongue is pink and her tonsils are about 1+. Her teeth are white. Her gums are not retractive. Whew. Thank you. So now I am going to check your neck. So what I'm going to do is I'm check your carotid pulse. So I'm gonna. It's about 2+ bilaterally. So now what I'm going to do is I am going to auscultate the carotid pulse with my bell to check if there is brewing present. Oh. Can you take a deep breath and hold it for me? And relax. And one more time. Thank you. There is no brewing present for the patient. So now what I'm going to do is I'm going to check her lungs, interior lungs, interior, posterior, and her heart. So first I'm actually going to start with her heart. So what I'm going to do is I'm going to go from aortic, pulmonic, tricuspid, and mitral. And I'm going to listen for any heart murmurs that could be present. So you can breathe normally for me. So it's aortic to pulmonic, herbs, tricuspid, there it is, and mitral. So now at this point, I'm going to listen for her heart rate for about 1 minute at apical heart rate. So let's just say it was 1 minute, so I'm good to go. So now I'm using my bell, and I'm going backwards to also listen to heart murmurs. And I'm starting again from the mitral. And I'm going to the tricuspid. And I'm going to herbs. Then go pulmonic. And aortic. So now what I'm going to do is I'm going to check her lung sounds and see if there's no adventition sounds present. I'm going to do with my diagram. So now, sorry, my patient's sick, but I'm going to ask her to take a deep breath, but I'm not going to ask her to do this for 10 times because she might pass out, so that's not good nursing. So you can take a deep breath for me. Thank you. Thank you. Thank you again. And again. And again. And you can relax now, it's okay. Sorry, I'm blocking the video because I'm such a nice nurse. I'm trying to make sure she's okay when she's breathing. Can you take a deep breath for me? How many was it? 1, 2, 3, 4, 5, 6, 7, 8. Maybe just do 2 more right here. Do it again. Thank you. So now, there's no addition sounds present anteriorly and anterior side of the chest. So we're going to go back. And we're going to go same thing in 10 places. So can you take a deep breath for me? And again. You can relax now. 6, 7, 8, 9, and 10. So once again, there's no adventition sounds present at the posterior side. Can you please lift up your arms for me? So now I'm going to check for interior posterior diameter. So it is 1 to 2. I'm also going to check for coscus vertebral inguinal. So I'm going to, okay, I'm going to hit you nicely and tell you if it hurts, okay?
Nope. Nope.
So there's no tenderness present there as well. So now, can you please see your arms now? So I'm going to check her radial pulses, brachial pulses, and her clubbing and her capillary refill. So the radial pulse is about 1 plus. The brachial pulse is also 1 plus. So now I'm going to see her awesome nails, and I'm going to see if the nails are having a good capillary refill, and they should do, young lady. So they're to 1 to 2 seconds, which is appropriate, which is great. That's what we want to see. All right, clubbing, please. Let me see that. Nice little nails. So there's no sign of clubbing present as well. Oh, and on this one too. I'll check it too. Very nicely done. Can you please lay down for me, young lady? Okay, so now I'm going to check her abdomen. So first I'm going to lay down and I'm going to check the contour. The contour is flat. So now I'm going to get up because you saw me get up. So now I'm going to check her. There's any lesions, striations, and there's none present at this point. So now I'm going to check the four quadrants of her abdomen. We're going to start on the right upper quadrant, going down to the left, right lower quadrant, then right lower quadrant, then left lower quadrant, and upper left quadrant. So what I'm going to do first is I'm going to auscultate for bowel sounds. And if I don't hear bowel sounds, I'll listen for about 5 minutes in each side. So, with my diary. So, all bowel sounds are present. So now I'm going to percuss and palpate to see the tenderness and see if the patient has any pain, and then see if there's a tympany present in 3 out of 4 quadrants. I'll tell you why in a minute. So first I'm going to percuss you first. Don't worry about it. It's going to be very nicely. That hurt?
No.
Does that hurt?
No.
Does that hurt?
No.
Does that hurt? No. Actually, that's palpating. I'm sorry. I completely screwed it up. But now I'm going to percuss. So a little quiz for you. So now I'm going to percuss, and what I'm trying to figure out is the tympany. So I'm going to start the right lower quadrant. So then I'm going to move to right upper quadrant. Did you hear that? That is the liver telling me how dull it is. Well, that's okay. That's liver. That's expected. And then this is the lever upper quadrant, and this is the lever lower quadrant. So 3 out of 4 quadrants have a tympany, and the right upper quadrant has, what does it have? You tell me that. You can't tell me. It is dull because of the liver. So right upper quadrant has liver, left upper quadrant has stomach, left lower quadrant has the semicolon, and right lower quadrant has appendix. So as my patient nicely is enjoying her day with me, I'm going to check for her lower extremity. So first I'm going to check for edema. Is it present? I don't think so. I don't see it. So that's good. That's not there. So now I'm going to check her. Actually, can you set up for me? So it'll be easier for me to check your pulses and the likes. So you can come here. You don't have to be scared. So now I'm going to check your articular pulse, tibial pulse, and dorsalis pulse. Now I'm going to palpate the pulses. So I really want to feel it. You know, it's hard to find. So they're more like 1+ there, and dorsalis is right on here. A 1+ and tibial. I should find your pulse 1+ too. So now you should turn it on for me and lay back again for a second. Okay, so now I'm going to do the Babinski test. The Babinski test tests the urological abnormalities that the patient might have. So that's a little nasty. That's holding hair for you there. So what I'm going to do, I'm just going to swipe my finger up. And as you can see, her toes do not react, which is good, which is expected for age. Up, and again, there's no reaction present. So now you can get up for me for a second. So if we're going to put on your shoes. Thank you. We'll step on them. There you go. So now what I'm going to do, I'm going to have you close your eyes. And I'm going to check if patient can stand on her own. There's no swaying, or checking her ability to stand by herself. Thank you. So by doing the Romer test, I know the patient has no risk of falls. So what I'm going to do now, I'm going to check her gait. Can you please go to that table back for me? As you can see, the natural gait is normal and smooth. There's no problems with the natural gait. So with that being said, there's also if the patient is struggling to walk, of course I'm gonna walk behind her, make sure that she doesn't fall. So now, can you please bend for me? Is that all you can do? There you go. So I'm going to check her spinal curvature, which is S-shaped. Thank you. Did I do anything for you back? Young lady, help me out. No, I think I did. Well, let me think about it for a second.